Advancement at TriHealth hospitals could mean better outcomes for lung cancer patients. Joining us to explain how this works is this week's TriHealth Doctor on Call, Dr. Craig Eisentrout. Thank you so much for being with us today.
Hi, Julie. How are you?
I'm doing great. I'd love to say I know of a few people who have had very serious cases of lung cancer who were not smokers. It's much broader than that, is it not?
It is broader than that. It's made more complicated here in this part of the world because we have a common issue with small spots or nodules found on our CAT scans or x-rays pretty frequently. Here at TriHealth, we've had a system for looking at those for the last 10 years and seen probably 5,000 patients like that.
Is this the Ion robot?
The Ion robot is a way to try to get biopsies of these small spots when we don't have other options. The technology is not entirely new, but the way of using this robot is brand new. Only about 20 centers in this country have this technology. TriHealth was very forthcoming in actually looking at this new technology and finding a way for us to use this in advancing our diagnostic techniques for patients potentially with lung cancer.
So talk to me like I'm a fifth grader, or actually not that smart. What does this, how is this so different from what they have at many good hospitals? What is the change in how I'm going to get answers that I need for my health and future?
The way this is different is it finds a way to navigate to very small spots within the lung where we could not do biopsies before. The only options we had in the past were either having it removed, which may not be necessary, or watching it for a while, which may potentially give that spot a chance to grow and potentially spread. So this gives us an option that really wasn't present. It's a new kind of technology to find your way out to these small spots and do small biopsies, get people answers early on.
Do you feel like in your experience, Dr. Eisentrout, you may have saved some lives with this thing?
It's fairly new technology, so I think the process we have through the whole lung program here has done that. This is going to be a big part of that. It's too early for me to say how many lives have been saved so far, but we've certainly made diagnoses where we wouldn't have had that opportunity otherwise.
I know, you know, at my workplace, when you get a new tool to make it faster and better, it's very exciting. What's your level of enthusiasm about having this new robot, or at least it hadn't been around that long?
Very high. My undergraduate training was actually in engineering, so this kind of fits with me perfectly. It's new technology. It's made by the same people who make the Da Vinci operative robot that is so widely used across the country. So very blessed to be able to use this and to provide this option for our patients here.
Very good. Dr. Eisentrout, we sure appreciate your time. And we have to wrap up, but just one quick answer. Are you starting to see more foot traffic, more people coming in, less fear of COVID and patients returning?
Absolutely, yes.
Yeah, I'm glad to hear that. I just want to check on that every week. Thank you. You have a blessed day. Appreciate you weighing in. We are going to turn to the forecast now with a